Okay, now. Hello, guys. How are you all? Good evening, Shweta. Adil, good evening, Adil. Vanilla, good evening. Pramila, good evening, Pramila. Sunny, good evening. TVD Beast, good evening. How are you all, guys? It has been a week since I had a discussion with you all, right? So I hope you have revised the previous classes, right? I want all of you to tell me that at least you have revised the previous class, or from the notes which you have prepared, right? I'm fine, Sunny. Thank you so much. How are you? Hi, Shreya. Good evening, Shreya. Seelam, Subhash. Good evening. Motive things. Good evening. Good evening, motive things. Revised. Very good, Vanilla. I hope all of you have revised, right? And today, guys, today we shall be discussing. In the previous classes, we have discussed till the muscles of the forearm, right? So in today's lecture, we shall be discussing the muscles of the hand. You know, the intrinsic muscles of the hand, and really they are very difficult. And what is more difficult than that is the nerve innervation. You know, we have got the major nerves like radial nerve, median nerve, ulnar nerve, right? So how are they passing? Their course is really very difficult. And the third most difficult thing is that at which level injury happens, what happens, I mean, how does a hand look, what are the gestures, right? So for example, if there is a cut here, if there is a cut here, so it would be really difficult. But don't worry, I want you to pay full attention as usual, as usually. Online school, hi. Hi, SMU. So, guys, shall we start? Shall we start? So, look here, guys. Previous class we have revised regarding the muscles here, right? So, we have also discussed. I hope you are also following the clinical points, isn't it? Clinical points are very important, guys, because in the upcoming exams, clinical is the only thing that they are going to ask you. That's it. Fact-based questions are gone. What are the most commons? What are the least commons? What is the first most common? What is the second most common? These things are gone. Now everything will be clinical. Okay. So swan neck deformity, jersey finger, baseball finger, mallet finger. I hope all of you have revised this, right? So can anyone tell me? Okay, I'm closing this. Can anyone tell me if there is a rupture of the tendon here on the flexor region? So what kind of finger do you call it as? कोई बात नहीं सन्नी, कोई बात नहीं, बीच बीच में हम हिंदी भी बोलेंगे, ठीक है? Very good, Shreya. It is very good, Saikat Paul. Very good, very good. It is called as jersey finger, right? The same way, if it is on the back, it is called mallet finger, right? If it is on the back, it is called as mallet finger, right? No worries about that. Very good. So, shall we start, guys? Shall we start discussing now? We shall start discussing. We shall start discussing with the cubital fossa. Are you all ready? Yes or no? I need a green signal so that I'll start it. Yeah, right. So let's get started, guys. Very, very interesting topics we shall be discussing today, right? I want you to focus. I want you to give your 100% attention to the lecture which I'm teaching. Okay, right? So when I come to the cubital fossa is always a question that is asked. Cubital fossa is always a question that is asked in the exams. Cubital fossa is very important for your exams. Okay, so when I discuss about cubital fossa, first important thing they will ask you is that what are the boundaries of cubital fossa, what are the contents of cubital fossa, okay, and what are the structures that are related to it. Now all of you look here, this is your humerus. Okay, what is this? This is your humerus. Next important thing is that exactly here where there is an injection site, right? So exactly here, this fossa which you can see here, this is called as cubital fossa. Okay, so let me draw that cubital fossa first. So this is your humerus, right? And next important thing is that if you have revised the muscles previously which I've taught, I told you what is the common flexor origin. Common flexor origin is medial epicondyle. Common extensor origin is lateral epicondyle. So from medial epicondyle, the first muscle which we discussed, which was going like this, right? It is responsible for pronation. Do you remember that, guys? I want your reply. What is that? Excellent. Very good. Very good. It is pronator teres. Very good. Gohita, very good. It is pronator teres. And in the same way, in the extensor also, we have discussed the first muscle in the extensor compartment. What is that? Look here, brachioradialis. Brachioradialis is the first muscle, right? So look here now. Let us say, all of you look here now. Let us say that this part is medial epicondyle. Okay. This part is lateral epicondyle. Now, from the medial epicondyle, there is a muscle I told you which comes all the way like this, right? So, this muscle you call it as pronator teres. Pronator teres. Okay. Next important thing is that there is also another muscle that is coming from the lateral epicondyle. It means the extensor point. So, this muscle you call it as brachioradialis, right? All of you know that this is brachioradialis. Right? Now you can see a triangle that is formed, right? You can see a fossa that is formed. This fossa here is called as your cubital fossa. So question number 1, what are the boundaries of cubital fossa? The first important thing is that the boundaries of cubital fossa are 3. From lateral epicondyle till medial epicondyle, if I am drawing an imaginary line, right? If I am drawing an imaginary line from lateral epicondyle to medial epicondyle, this is called as the base of the cubital fossa. Next important thing is that this line which I am drawing towards the pronator teres, this forms the medial border of cubital fossa because it is towards the medial epicondyle. The another line which I am drawing like this forms the lateral border of cubital fossa. So what are the 3 borders of cubital fossa? One is called as the base, another one is called as the pronator teres, which forms the medial border. Pronator teres forms the medial border. Okay. Next, brachioradialis forms the lateral border. So, medial border, lateral border, base. We are done with our first question. Borders of the cubital fossa. Now, contents of cubital fossa. What are the contents are? Look here, guys. This is your biceps muscle, right? If you palpate inside, you can feel a tendon in the cubital fossa, right? That tendon is nothing but the tendon of your biceps muscle, tendon of your biceps brachii. Okay, that is your tendon of your biceps brachii. So whatever it is, how do you remember the contents? Contents are remembered in this way, guys. Remember it as R tan. From lateral epicondyle till medial epicondyle, remember it as R tan. What does R stand for? R stands for radial nerve. R stands for radial nerve. Okay, this is R. R stands for radial nerve. Next, what does T stand for? T stands for tendon of biceps brachii. So this is your biceps brachii. This is your biceps brachii, right? So biceps brachii has got a tendon, and this is called as a tendon of biceps brachii. Third important thing is A. A stands for artery. What is the artery here? Can anyone tell what is the artery? Yes, very good, Ubay. Very good. What is the artery, guys? Very good, Dr. Lippan, very good. So we have got an artery in the center. This is called as a brachial artery. You know, brachial artery will divide into 2 branches. This is called as a radial branch. This is called as an ulnar branch. I mean the radial artery and ulnar artery, right? So brachial artery is dividing into radial as well as ulnar. And finally, N. N stands for a nerve. What is the nerve again we have here? This is the median nerve. What is this? This is the median nerve. So if I'm writing all of them down here, if you can look at this picture, right? So this is your brachioradialis. This is your pronator teres, right? And this one is your radial nerve. And this one over here is your tendon of biceps brachii. Okay, and this one over here is called as your brachial artery, and finally this one is called as your median nerve. So from lateral to medial, these are the structures which are present. All of you are clear with this, guys? Are all of you are clear with this? Understood? Very good, very good, very good, excellent. So let us move on to the next one, guys. The next one is that this was a question that was previously asked. What is the question here? In the cubital fossa, if you can look at the question here, let me zoom it out a little bit. Right, in the cubital fossa, which structure is medial most? This was a previous year question. Which is the structure that is medially located, most medially located? What is the structure? Anyone? Very good. Most medially that is located is median nerve. Most medially, if there is a structure that is located, that is your median nerve. Very, very good. Okay. Now, let us go on to the next thing. Coming on to the muscles of your hand. Okay. Now, when I'm discussing the muscles of the hand, keep in mind one thing. All of you, look here. When I'm showing this like this, right? When I'm putting my palm like this, here you can see an elevation here, right? So all of you don't write anything. Only if you see me, you can understand this. You can see an elevation over. This is called as thenar eminence. Below that, you can say another elevation below the thenar. So you call it as hypothenar. This is called thenar. This is called as hypothenar. Okay. So the first group of muscles which we have is thenar muscles. Thenar muscles. Next, we have got hypothenar muscles. Hypothenar muscles. Okay. So we have got two groups of muscles. One is called as thenar, another one is called as hypothenar. Now, when it comes to thenar, I want all of your attention. Look here now. First important thing, I am able to move my thumb away from my body. You see, I am able to move my thumb away. So when I'm moving it away, this is called as abduction. This is called as abduction. When I'm moving towards my body, this is called as adduction. So right now I'm doing abduction. So the first muscle is abductor. Abduction of what? The thumb finger. Thumb is called as pollicis. And this muscle is small because it is located in the thenar region only. So it is called brevis. Abductor, pollicis, brevis. Second important thing. Next important thing is that I am able to flex my thumb. I am able to flex it. So it means the muscle will be flexor, pollicis, brevis. Flexor, pollicis, brevis. Third important thing is that I'm able to count my fingers. I'm able to count my fingers. How am I counting? My thumb is going against each finger. It is going opposite of each finger, right? This is called as opposition. This function is called opposition, right? So the muscle here is opponens pollicis. Opponens pollicis. Opposition of pollicis is called as opponens pollicis. And fourth important thing is that, as I told you, my finger can be adducted, right? My finger can be abducted like this. The same way my finger is also adducted towards my body, right? See, abduction, adduction, abduction, adduction, right? So this muscle is called as adductor pollicis. Adductor pollicis. This is called as adductor pollicis. Are you clear with the thenar muscles? My main intention is for the first, second and third year students, I want you to understand it so clearly, right? Have you understood, guys? Is this thing clear? Everyone, be first. Very good, very good, very good. I don't understand why few students joined. Maybe is there any other class going on there? Right, whatever it is. Coming to hypothenar muscles. Now, when I will be discussing hypothenar muscles, look here. Look at the little finger. Little finger in Latin you call it as digiti minimi. Okay. Now I am moving my little finger away from my body. So this is called abduction of little finger, right? So can I call it as abductor digiti minimi, not pollicis brevis. This is digiti minimi. Digiti minimi. Abductor digiti minimi. And after that, the second important muscle, I am able to flex my little finger. It means the muscle which is working here is flexor digiti minimi. Flexor digiti minimi. Okay. Next important thing is that I am even able to touch my thumb finger. My thumb is here. I am able to touch like this, right? It means opponent's function is working, opposition is happening here. So the muscle will be opponents digiti minimi, opponents digiti minimi, and there is a small muscle here that is called as palmaris brevis. That is called as palmaris brevis. Have you understood all these muscles, guys? Yes? Yeah? You have understood thenar muscles, you have understood hypothenar muscles. So these two muscles are only little bit difficult, but remaining all the muscles are easy. Okay? Right. Next group of muscles which we have are, we have got some muscles in the center here. These muscles are attached to tendons, right? These muscles are called as lumbrical muscles. Okay? These muscles are called as lumbricals. I will show you. I will also teach you the origin and insertion. Don't worry about that. Okay? So these are called as lumbricals. How many lumbricals we have got? We have got 4 lumbricals. Lumbrical number 1, lumbrical number 2, lumbrical number 3, and lumbrical number 4. In the same way, in the palmar region also, between the two bones, these are called as metacarpals. Metacarpal 1, 2, 3, 4, 5. In between the metacarpals, we have got muscles. In between the metacarpal bones, we have got muscles. So I have to call it as interossei, in between the bones. So I have got two types of interossei. One on the palmar side, one on the dorsal side. Right? So 4 on the palmar side, 4 on the dorsal side. So you call it as palmar interossei. Palmar interossei. Next, you also call it as dorsal interossei. Dorsal interossei. Okay. So two groups of muscles: palmar interossei as well as dorsal interossei. Okay. Again, how many palmar and how many dorsal interossei we have got? 1, 2, 3, 4. 1, 2, 3, 4. That's it. We are done with the muscles of the hand. Clear? I will be telling you about each and every muscle right now. So regarding the nerve supply, I'll be telling you right now. But have you understood whatever I've taught now? Till here, before I go to the next one. Be fast, guys. Be fast. Yeah? Very good. Now look here. Coming to the nerve supply. Coming to the nerve supply, look here very, very, very carefully. Regarding the nerve supply, all of you look here, all of you. The first 3 muscles in the thenar region, the first 3 muscles of your thenar region, are supplied by median nerve, and in the lumbricals also, the first 2 lumbricals are supplied by median nerve. Okay, so how many muscles? See here, 4, 4, 4, 4, 4. I think 20 muscles are there, right? Out of all these 20 muscles, how many muscles are supplied by median nerve? In the thenar region, we have got abductor pollicis brevis, flexor pollicis brevis, opponens pollicis. In the lumbricals, first lumbrical and second lumbrical. So these are the muscles which are supplied by median nerve. Remaining all are supplied by ulnar nerve. Keep that thing in mind. Okay. So I'll write it as other than yellow, right? Other than yellow muscles. Yellow muscles means don't think what is this different type of muscle. Whatever I've shaded it in yellow muscles, so those are the yellow muscles. So other than yellow muscles, all other are supplied by ulnar nerve. Ulnar nerve. Whereas yellow muscles are supplied by median nerve. Median nerve. So this thing you just have to clarify within your mind right now. Clear? Thank you, Ijaz Khan. Thank you so much. I'll start thorax immediately after this. Okay, don't worry about that. So I hope you understood it, right? Next important thing. Next important thing is that, love you Ashish, love you too. Next important thing is that within the thenar group, we have got a fourth muscle. Can you see here? What is this fourth muscle, guys? Adductor pollicis. Obviously, adductor pollicis will be supplied by which nerve? Ulnar nerve only, right? Adductor pollicis is called as graveyard of ulnar nerve. Why it is called graveyard of ulnar nerve? I will tell you after 10 to 20 minutes later, okay? But just now, remember this as, this is called as graveyard of ulnar nerve. Most of you might have already known, but for those of you who don't know, I'll tell you later on. Okay. Adductor pollicis. This is a question which was asked. Adductor pollicis is called as the graveyard of ulnar nerve. Okay. So this is the important thing you have to remember. Next important thing is that what are the functions of thenar muscles? I have already told you. What are the functions of hypothenar? I have already told you. Now let us enter into the functions of lumbricals, palmar interossei, as well as dorsal interossei. Okay, right. Coming to lumbricals. When I will be discussing regarding the lumbricals, when we discussed the forearm in the previous class, we have discussed forearm. I have told you two muscles are there, right? These two muscles are having four tendons each, and these four tendons, one muscle tendons gets attached to the middle phalanx, other muscle tendons get attached to the distal phalanx. What is this muscle now? Tell me. Yes, I'm waiting for your comments. You remember this thing, guys, here? You remember